Okay, so for our prevention program, we've decided to focus on the H1N1 strain of influenza. H1N1 originated in birds and began its spread in 1918, but we deem it more important to focus on the most recent pandemic it caused in 2009, which originated in pigs. H1N1 is presently better controlled and less deadly due to the creation of a vaccine, but it's not necessarily extinct. It's important to first prevent the virus by receiving the vaccine, but also recognize symptoms of the virus and seek medical assistance if appropriate. Some of these symptoms may include fever, cough, sore throat, chills, and body aches. H1N1 infects the cells within the lungs in addition to upper airways of the body like typical influenzas. Upon studying deadly cases of H1N1, pathologists were able to identify the early stages of bacterial pneumonia as contribution to death related to H1N1. As mentioned in the introduction, there has been a production of an H1N1 vaccine, and it is widely accepted in the medical world, and therefore the majority of the population does vaccinate against H1N1, making it quite difficult to find some present data. So we've decided to focus on past data from 2009 at the heart of the H1N1 pandemic. The H1N1 flu mainly affected younger generations due to their lack of immunity, while over 30% of people 60 years or older had antibodies protecting them against this viral influenza. These antibodies were believed to be from pre-exposure to a similar virus, which could have been from the 1918 avian H1N1 influenza. Worldwide, 80% of H1N1 related deaths occurred in people under the age of 65. This differs from typical influenzas, where 70 to 90% of deaths occur in those 65 and older, which is why we decided to focus on those under 65 for our prevention program. In the United States alone, from April 12, 2009 to April 10, 2010, the CDC estimated 60.8 million cases of H1N1, 274,304 hospitalizations, and 12,469 deaths due to the H1N1 influenza. While across the world, the CDC estimated anywhere from between 151,700 to 575,400 people across the world dying from H1N1 during the first year. Although significantly less common or deadly now, it is still important to continue to protect yourself and others from H1N1.
A few common signs and symptoms of the swine flu include fever, headache, and cough. The respiratory symptoms vary from a simple sore throat all the way up to difficulty with breathing. The type of infection is an upper and lower respiratory infection, and the recovery rate is around 2 to 7 days.
As a group, we have designed an original evidence-based prevention program that focuses on primary, secondary, and tertiary prevention options against the H1N1 virus. To start off, I would like to focus on the primary prevention of the H1N1 virus. It's important to place most of our focus towards primary prevention. This helps us to be able to intervene early, and by doing this, it will help to pay less for the disease overall and in the future. Early intervention is critical for all people. The main goal of our prevention program is to focus on preventing the H1N1 virus by specific protections, including health promotions and proper education. For example, this can be done by frequently washing your hands for at least 20 seconds. It's also important that people have the correct education on the proper way to wash your hands. This is to lather the front and back of your hands, between your fingers, and under your nails, and to scrub them for at least 20 seconds. This is about equivalent to singing the happy birthday song twice. Next, covering your cough or sneeze, avoiding contact with people who are sick, staying at home when you are sick. Those are all essential first steps for preventing the H1N1 virus. I think that most importantly, the annual flu vaccine is the best way to prevent H1N1. This vaccine protects against 4 different flu viruses and includes the H1N1 virus. The flu vaccines are constantly changing, but the CDC announced what the 2020-2021 seasonal flu vaccine will protect against, and H1N1 is included. Depending on the vaccine, flu vaccines can protect against 3 or 4 different types of viruses, not just one. I think that also educating people about how direct and indirect contact transmission works, along with discussing other routes of transmission for influenza, is important as well. In order to prevent something, having the proper education and understanding of the health topic can help. Indirect contact transmission is when somebody coughs or sneezes directly into their hand and then proceeds to touch a public surface, which transmits the virus onto that surface. When another person comes along and touches that same surface, and then touches their face, mouth, eyes, ears, or nose with their contaminated hands, they can become infected with the virus. This is another reason why properly washing your hands is so important. When talking about direct contact transmission is when somebody who is infected with the virus coughs or sneezes into the air. This causes droplets in the air to be breathed in by other people, which causes them to become infected. Coughs and sneezes can travel really far even though we can't see them, so it's important to cover your coughs, sneezes, or even wear a mask, which is what everybody's doing at this time with COVID. We can also talk about and educate others about other ways of transmission. An example of one more way of transmission is droplet transmission, which is another form of contact transmission. This is when respiratory droplets carrying infectious agents will transmit infection when they travel directly from the respiratory tract of the infected person to surfaces of the other person. This is generally over short distances. This shows that social distancing yourself from others and wearing a mask is important as well. There are more modes of transmission, but these are the most important to focus on when trying to prevent H1N1 virus. For secondary prevention, our main goal is to have an early diagnosis and provide prompt treatment. We also want to work towards reducing the severity and the spread of the disease. It is very important to seek medical attention if you are experiencing symptoms of the H1N1 virus, which include fever, cough, sore throat, chills, and body aches. The H1N1 virus is a strain of the influenza A virus. This causes the symptoms of the H1N1 virus to be very similar to seasonal flu symptoms people experience. If somebody is starting to feel sick, it's very important for them to seek medical attention right away. By doing this, it could potentially lead to an early diagnosis of the H1N1 flu. This can allow it to be treated early, and it also helps to prevent spreading the virus unknowingly if it is caught early enough. For tertiary prevention, our goal is to focus on the treatment and rehabilitation of our patients. We want to focus on improving the quality of life of those whose health have been affected by the H1N1 virus with early treatment. This can include antiviral drugs that can potentially help to lessen the severity of the patient's symptoms and shorten the time that the person is sick. Antiviral drugs are prescription medicines that fight against flu viruses in the body. Antivirals are different from antibiotics because antibiotics fight against bacteria, while antivirals fight against viruses. Typically, they work best when they're started soon after the flu illnesses begin. Not only can they help to lessen symptoms and shorten the time that the patient is sick, but they can help to reduce the risk of further complications from the flu, like pneumonia, and becoming hospitalized from other respiratory illnesses. Antivirals also help to reduce the risk of ear infections in children who have the flu. For people who are at a high risk of developing serious flu complications, early treatment with antiviral drugs can help them to have a milder illness rather than having a severe illness that may require a hospital stay. Antivirals are shown to work best when they are started within 2 days of getting sick, but studies from the CDC have shown that even starting them later can still be beneficial, especially if the person who is sick is at a high risk of flu complications. It's important to follow the instructions for taking these drugs. One example of an antiviral drug is Tamiflu. Tamiflu is typically prescribed for 5 days, but for some patients treatment could be longer depending on how severe the flu is. There are other antiviral drugs, but Tamiflu is just one example. By reducing symptoms and the time that the person is sick, we can help to improve their quality of life, and we can also help to prevent any further flu complications.
Some final recommendations and overall conclusion that we have for the prevention of swine flu is to make sure that you are always washing your hands to kill any germs and to avoid contact with people that are sick or may be experiencing symptoms. Getting a vaccine may also help you avoid the virus in all. This will help you in the long run avoid getting the swine flu. But as we know, we don't always get to avoid viruses no matter how hard we try. If you are feeling sick, it is important to see your doctor as soon as symptoms arise. the doctors will most likely proceed with antiviral drugs to help with the